So Amelia, as we progress through your session today, we're going to take some time to talk about any concerns you have, what you're hoping to get out of your physio treatment today, what you might already know about your back, and how we're going to treat and manage it moving forward. So if you have any pain sitting in this position at all, please let me know and we can change and move around. So you were quite concerned about moving your back earlier.
Yeah.
Is there anything else that you're concerned about?
Just that I just think that because I only just injured it, it's quite sensitive, and I just really don't want to aggravate it or make it worse. I think I just need to rest it more or something.
Okay. So I understand what you're saying, and it's actually a really common feeling to feel like this. It's a common misconception that your back is fragile and needs to be protected, but research actually proves this otherwise and says that normal movement and activity throughout your treatment is really good for improving your outcomes. So research suggests that your back is actually really strong and robust structure. So moving it just further makes this even stronger. So we know that exercise is the best intervention for improving your symptoms and your outcomes going forward. So we found from studies that using a graded exercise program where we slowly increase your intensity and we just specifically tailor to your needs is really good for improving your outcomes. So various studies have found that just doing normal exercise on a day-to-day basis and maintaining what you do normally is really good for continuing your outcomes despite the fact that there may be pain and discomfort. So this usually results in a faster recovery, less chance of chronic disability and pain, and a quicker return to work, which is really good. So does that all make sense?
Yeah, it just seems so weird to me how exercise is meant to help when it just seems too aggressive for what I've got.
Okay, I understand. And because you're in quite a lot of pain, what we will do is we'll start at a non-weight bearing reduced load position, and then we'll slowly increase to weight bearing and functional movement. So starting in this non-weight bearing position then increases your movement and relieves your pain. So then we can see how we can then start moving forward. So it's just a starting base. So as also, we'll use those, as we found earlier, we found extension was quite helpful in relieving your pain, and we did those repeated movements of extension in that non-weight bearing position. So what we will do is we'll use that in your treatment, as then we know that that relieves your symptoms, and it's really positive for outcomes going forward based on research and studies.
Yeah.
So is that clear?
I just don't quite understand how if I exercise and it's causing pain, how that's not causing more damage to my back.
Okay, I can see how you may feel that way about pain, and that's pretty normal because pain's really confusing to understand. But we actually know there's not really a strong correlation between pain and damage. So it's actually a really poor indicator of harm, and there's a lot of factors influencing your pain, and your tissues can become a bit more sensitive when you feel pain. So every time you move, they're releasing a chemical messenger, which then increases the sensitivity, and you may just be feeling this sensitivity rather than actual damage. So we know from research it's okay to continue exercising with pain so long as it's below a 3 out of 10 level, where 10 is the most pain you've ever felt in your life, and 0 is no pain at all. So as long as it's below this 3 out of 10 level, we're all good. Yeah. We also know that bed rest and avoiding moving is not going to be very good for your long-term outcomes at all. So now I just want to gain an understanding of what you know and if you've been told anything about your back already.
I haven't really been told anything so far. I'm just a bit confused and really unsure what's going on.
Okay.
I just know that when I picked up the suitcase, it caused quite a lot of pain, and so I think I might have done quite a bit of damage there.
Okay. I understand where you're coming from, and I think at this stage it's really important for you to know that from our tests earlier, we found absolutely no serious problems at the moment that may require going further with the referrals, which is really good.
Yeah.
So research suggests really good outcomes from our management strategies such as exercising, maintaining your movement and normal activity. So we know that within 2 weeks of these programs, 50% of people are completely recovered, and then by 6 weeks, 80% of people, which is really good signs for you going forward. So as I mentioned earlier, despite your pain, your back is actually really strong and robust. So we know that with lots of supporting structures and ligaments around it, if we increase your movement, it's going to be even stronger. So what we'll do is we'll use exercises to strengthen your back and make you feel a bit more confident with moving it. So there's also lots of research to suggest good outcomes from returning to work early. So we want to maybe modify your hours or your tasks at work if that's possible, do you think?
Yeah, I think that should be fine. I can talk to my boss about that.
Okay. What else were you hoping to get out of your physio treatment today?
I think that I would like to get an MRI just to see what sort of damage I've done.
Okay, so if you'd like to go through that, then we can definitely look into it. But research suggests that MRIs may not actually give you a better prognosis. So we know that there's a number of factors that indicate if you need them. And as I said earlier, that you have no serious damage. So it's not really going to be essential for you to go and get an MRI.
Yeah.
So we know that 80% of the population actually have abnormalities on an MRI or degenerative changes, and they don't have pain at all, which is pretty crazy. So there may actually not be any correlation between your pain and damage at all. So there's generally not a correlation. So it's not a very good relationship. So we know that MRIs are not very suitable for situations like yours, and they're not needed. So it's not going to change how I'm going to manage your pain. It's not going to change your outcomes going forward. So do you have any more questions about anything?
No. I'm pretty good.
Okay. So is everything all clear and makes you
Yeah,
understand?
it's been really helpful.
Okay,
Yeah, I think I
that's
understand.
good. So if you come up with any questions in the next week, we can have a similar chat next week, and I'm happy to go over anything that you may need. So now we're just going to move on to the next part of our session and do some exercise and give you some management strategies for what you can do at home. So does that sound good?
Yeah, sounds great.
Okay, awesome. Thank you.